Hi everyone, this is Dr. Marge Riley, the Academic Director for Nursing at the CUNY School of Professional Studies. I want to welcome you to this information webinar. Today we're going to talk about the RN to BS program in nursing, as well as a new dual joint BS-MS option for RNs as well. We're delighted you could join us today, and we hope you'll gain some useful information that will assist you in your decision to return to school and whether an online program is the right fit for you. So let me just tell you a little bit about myself. I grew up in the New York City area. Like many nurses, I worked in a lot of different areas prior to teaching, including in the emergency department as well as a visiting nurse. Before I took this position as the Academic Director for Nursing for CUNY's first online nursing program, I was on the faculty at Queensborough Community College, also a part of CUNY, for 15 years. I taught medical, surgical, and community nursing there. I completed my doctorate in 2012 at the CUNY Graduate Center, so I do understand what it means to go back to school and work and have family. And while pursuing my doctoral studies, I was selected as a Jonas Scholar for Nursing Excellence, an organization that promotes doctoral education among nurses, and I focused my research on associate degree nurse graduates and factors that affected their motivation to return to school. My background also includes selection as a 2010 Health Information Technology Scholar, in which I was part of a national team of nursing faculty to integrate technology into the nursing curriculum. And I've served as a commissioner on the National League for Nursing Certified Nurse Educator Commission. I'd like to introduce you to our associate director, Dr. Joanne Lavin. She has taught here at CUNY School of Professional Studies and has been a long-time CUNY faculty person. She previously taught at Kingsborough Community College, where she also served as chairperson, and then at York College, where she was the program director, and she helped to start a generic bachelor's degree program, an off-site RN to BS, and a dual joint enrollment program with Queensborough and LaGuardia Community Colleges. She has been an NLN test consultant, and she's certified as a clinical specialist in adult psychiatric nursing. We are very pleased to have Dr. Lavin here with us on the faculty. We also have some outstanding faculty that have joined us recently and will be helping us to lead some of our new programs. We have Dr. Eileen Shake, who has a background in leadership. She was the Strategic Policy Advisor for the Center to Champion Nursing in America in Washington, D.C., and she was the former director of the Organizational Leadership Program at the University of South Carolina. She's currently serving as an editor for the Online Journal of Patient Care. Dr. Kenya Baird is a Josiah Macy Faculty Scholar, and she was formerly the Vice President for Curriculum and Instruction at Jersey College. She is the founding director for the Center for Multicultural Education and Health Disparities, and we are pleased to have her join us here at the School of Professional Studies. Dr. Ann Simmons has a background in expertise in nursing management and leadership. She was the former director of an RN to BS program in the New York State area. Her research focus is on frontline nurse manager workforce issues and engagement, and we are pleased to have her join us here at the faculty. Let's talk a little bit about why you need to earn your bachelor's degree. First is it will enhance your professional knowledge, and that's an important aspect in your professional practice as you engage as a nurse in these current times of healthcare delivery. It's also important if you're thinking down the line that you may want to go to graduate school. First stop, you do need to have a bachelor's degree. And as many of you know, it will enhance your employment opportunities because we see that there's many places now that will not hire you unless you either have a bachelor's degree or you're already in a program. And I want to talk a little bit about some of those factors that are driving that. So the first is the Institute of Medicine report called The Future of Nursing. They had 4 key recommendations, and the one that I want to focus on today is number 2, which states nurses need to achieve higher levels of education. And they set as a goal for 80% of RNs to have a bachelor's degree by the year 2020. So this is not a mandate, this is not a law, it's a recommendation, but as you know, many institutions are taking this as one of their standards and benchmarks. The second key factor driving nurses back to school to get their bachelor's degree is the quest for magnet status. And those of you that work in the New York City area have probably been exposed to at least one facility that has been on the magnet journey. The Magnet Recognition Program is from the American Nurses Credentialing Center, and its purpose is to promote quality in a setting that supports professional practice. It is sort of the gold standard for nursing, and many agencies seek to achieve this as an indicator of the benchmark of quality in their facility. And one of their standards is that 80% of registered nurses should be working to obtain a degree, a bachelor's degree in nursing. So that sounds familiar. Yes, it comes from the Institute of Medicine's recommendation, and it is a benchmark now that many magnet facilities or those going for magnet status incorporate as one of their goals. And so that's another press for going back to school to get your bachelor's degree. So the other thing that is impacting nurses going back to school is the Affordable Care Act. And although there is some discussion about the Affordable Care Act and its repeal, there is general consensus that it is universally liked as far as providing access to care, and so those aspects of the Act will not go away. And as a part of the Affordable Care Act, we saw the expansion of roles for nurses to enhance healthcare delivery. New roles such as case management, health coaching, changes in how reimbursement is given, no longer just pay for a procedure, but pay for quality of care and who is the best person on the healthcare team to provide that care. You see increased use of technology for care management, and so nurses need to become familiar with how to utilize that. And there's an increased requirement for interprofessional care collaboration. So let's talk a little bit about what do you do when you consider looking at a program. And those of you that are listening to us today, I'm sure one of your questions is an online program right for me? So some things that you want to think about is, what does the school offer? Does it offer the program that you want? If you want to just go get your RN to BS, there's a lot of different options for you. Review the different websites of the different schools in the area, both CUNY, SUNY, private, and see if they meet your needs. If you're thinking that you want to go to graduate school in the very near distant future, consider that. Consider whether the program offers that as well. Look at the cost. How affordable is it? What's the tuition? How many credits will be transferred in, which will offset some of your cost? Time. How far away is the school? Do I have to drive there? Is it close to my home? Is it close to where I'm going to be working? Is there a day of the week that I can commit to going to school? Or am I thinking about doing an online program which doesn't require me to drive anywhere, but still does require my time? And while it may not require you to be online on a particular day, you still have to allocate a block of time that works for you. Think about the learning style. You know what traditional school is like. You show up, you sit in the classroom, the teacher stands at the top of the room, and you sit and listen and ask an occasional question. When you do school online, you need to be a much more active participant in your learning. And in some cases, it can be lonely because you don't have that personal interaction on a day-to-day basis with your classmates. So you need to find out what the best style is for you and whether that will work. Things to ask. In all RN to BS programs that are registered in New York State, there is a requirement for a clinical experience in community nursing. So does the school you go to, is that going to help you find a clinical placement, or are you going to be left to find that placement on your own? And do you have the capability to do that? So those are some good things to think about. Also look at, does this program accept students in both the fall and the spring? Because that could affect your planning. And all of these are important in your consideration. So let's talk a little bit about what happens at the RN to BS program in nursing at the CUNY School of Professional Studies. The areas that we like to focus on here in our curriculum, an emphasis on cultural diversity. We live in one of the most culturally diverse cities in the country, and so we want to emphasize that, how that can add to our practice, and we need to be inclusive. We focus on the role of the nurse as an educator, interprofessional practice, using evidence in our practice and how do we apply that, and developing leadership skills that will stay with us as we progress in our professional practice. So a little bit about us. We're part of the City University of New York. So when you come here, you get the benefit of the CUNY name. CUNY is well known throughout the country. It is regionally accredited by the Middle States Commission on Higher Education, and the U.S. News and World Report recently ranked CUNY School of Professional Studies in the top 8% in the United States for online bachelor's programs, not just nursing programs, but all of our bachelor's programs. And we are currently #1 in New York City and #2 in New York State. We're also accredited by the New York State Education Department, Office of the Professions, as well as the Collegiate Commission on Nursing Education. So a lot to offer in terms of credentials. So who are our students? Like you, many of them are working adults. They're in career transitions, or they want to make sure that they stay ahead in their professional practice. They often have families. They are people who want a degree program that will fit their schedule, and we have people from all over the world. So when you start in our BS program, we give you an advisor who stays with you from the start to the end of the program. We also provide tutoring, both online and on campus. You have a library. You have the dedicated library that we share with Baruch College, but you also have access to all of the CUNY campus libraries. And the wonderful thing about technology today is that you can access all of these library resources online. We do have a very robust help desk to provide tech support, and you can actually do that both online and in person. And we have a wonderful career services department that can help you with resume writing, interviewing, branding yourself, and so forth. What are some things that we do here that are unique? We capitalize on learning opportunities that use technology, as well as through collaborations with some of our outstanding partners here. For our health assessment course, we recognize that you're all nurses already, and so we wanted to provide an opportunity to build on the skill set that you already have. So it doesn't just focus on physical assessment, but really looks at health assessment from the perspective of cultural diversity and what are the skills that will add to your professional practice. We use virtual patient software called Shadow Health, and we also provide an opportunity for you to demonstrate your competency by working with simulation centers. In the New York City area, we work with the New York Sim Center, and you are exposed to a standardized patient program where you encounter a standardized patient actor, and we go through a simulation experience that students have rated very highly and say is very useful to their practice. We also have other unique learning opportunities, such as a symposium where we have annual speakers come and talk about clinical issues related to nursing. So we have these on campus. We invite you to come and join us if you can, and we have several of these throughout the semester. So other things that are unique about us, we admit you directly into the nursing program. Some schools admit you to the school first and then into the nursing program once you've met certain criteria. If you're accepted into the nursing program here at CUNY SPS, you can start right away with your nursing program courses. We do accept a select number of students who are new graduates before they take their NCLEX, and that is on a case-by-case basis. We do have admissions in both fall and spring, and we want all of our students to be successful, so we ask them to participate in the CUNY SPS New Student Online Orientation that we host, and we provide peer mentors during that experience. We don't have any science time limits, so if you took chemistry 20 years ago, that's still acceptable as far as transfer credits. We do provide assistance with the clinical placements that I mentioned earlier, and of course the CUNY name is an important part. So let's talk a little bit about what it's like to learn online. So a very important part of online learning is time management. Even though you are online at no particular time, we call that asynchronous, you still need to carve out some time during the week in which you do this work. You need to allocate about 9 to 12 hours a week for each 3-credit course. So you know you're not traveling back and forth to a classroom, you're not sitting in and listening to a 3-hour lecture, but you do need to make time to do the work of online learning, and that will involve such things as reading, listening to lectures, watching videos, researching responses to questions, and writing your answers and writing assignments. So a calendar planner is a really helpful thing. You need to carve out that time. You need to make sure that you have reliable Wi-Fi. You can't go to an online school and depend on a local coffee shop for their Wi-Fi access. You need to have something reliable in your own home that you can use regularly. You do need to have a computer. Although you can do many things on your smartphone and your tablet, there are many features and programs that you will need a computer for. We do have something called Blackboard Mobile now, which is an app that you can put on your smartphone or on your tablet, and it will allow you to access the Blackboard Learning course site, but we do recommend that you have a computer to use as well. So some student perspectives, and these are actually from one of our students who's now a graduate, and he recommends setting due dates before an assignment is actually due, so it gives you time to give it that one last look to make any edits and changes. Don't procrastinate doing your assignment. You don't need to clean the closet or do 3 loads of laundry. You need to sit down and you need to get that assignment done. Finding time, as we mentioned, to read and respond to your assignments. Being proactive when life happens and you've set aside time to do your work, but an unexpected emergency comes up and therefore that time is no longer available to you. Be proactive and talk to your instructors. Reach out to them. They want you to be successful, but they can't help you if you don't tell them. When you're feeling overwhelmed, just like anything else, deal with one thing at a time. What can you get done in 15 minutes, in 30 minutes, in 1 hour? And remember, all of you have already either graduated from a nursing program or you've made it into the pre-licensure program, so you're already successful. You can do this, and we are here to support you and help you. So what does an online course look like? We use Blackboard, which is the learning management system for all of CUNY, and we set up each course in nursing to be very similar. You have a menu on the left side of the page that tells you all of the information that's up and coming. An announcement page, who is your instructor, a little bit about them. Each course is set up week by week, and we are a traditional CUNY campus, so we have 15-week semesters in the fall and in the spring, and we have 7-week semesters in the summer. So week by week, week 1 you'll have work to do, etc. We have major assignments, the discussion board, a very big part of online learning, and we use something here called e-portfolios so that you can showcase your work for each semester and create a collection of your key learning products that you take with you. You can carry them with you after you finish school as well. This is an example of a week by week. You can see that the outside of the weekly folder tells you what's due, what you have to read, what your assignment is, videos, writing, etc. And each week there will be new work and new information. And so it's important that you find that time each week to go into your course site in order to be able to stay on top of things. So a little bit about our curriculum. For the bachelor's degree, the New York State Education Department says you need 120 credits to get a bachelor's degree. Students that come to us from an associate degree program usually bring in about 30 general education credits from their AAS program, and they bring someplace between 30 and 45 credits from their nursing specific degree as part of the AAS degree. So most students bring in about 65 to 75 credits, and then the remainder have to be earned here at the School of Professional Studies. So 30 of those credits are specific nursing courses labeled nursing. We also have 9 program credits, pathophysiology, chemistry, and statistics. And those 9 program credits can be taken at your current school. Maybe some of you have taken them already, and you can transfer those in. And then there are either 3 to 9 nursing electives that you take, depending on how many credits you transfer in. As I said, we offer classes in the fall and the spring, 15 weeks. We have 7-week summer sessions. We do have winter sessions that are 3 weeks. We do not offer nursing courses during those 3-week winter sessions, but there are general education courses that are offered at that time. And it's possible to complete the program in 4 full-time semesters or less. We have students that have completed it in about 15 months, and we have students that have taken 2 years to complete. You really need to go at the pace that works for you, and I strongly encourage students to start out with just 2 courses at a time to get used to the online learning format, especially if you're starting a new job and you have family. That's a manageable load. Remember, we advocate that you need to have about an average of 10 hours a week for each 3-credit course. So if you're taking 6 credits, that's at least 20 hours a week that you have to put towards schoolwork. So do your math. How many hours am I working? How many hours am I spending with my family, doing my family responsibilities, etc., and figure out what can work for you. Everybody's a little bit different. This is our bachelor's degree curriculum. You can see that we have our 30 nursing credits, and these are the titles of them. And notice that we have 2 courses that we've highlighted as clinical courses, the first one being the community nursing course, which we discussed earlier. And that requires 45 hours of a clinical experience in a community-based setting. And the second clinical piece is the capstone course, and we'll talk a little bit about them as well. We do also have elective credits that you can take. We offer a wonderful course on palliative care, case management, aging, and for those of you that need it, we can also do independent study options. This is a schemata of the nursing core curriculum, a suggested sequence, not the only way that you can take it. Notice that we do have several courses that we offer in the summer, and that's to help you move forward in your progression. So I don't want people to feel that they have to load up and take 4 and 5 courses at once in one semester. There are opportunities for you to move forward and to achieve your goal, but we want you to be successful in doing that. These are our program courses that I mentioned. They can be transferred in. And then, of course, you do need to complete your general education requirements sufficient to meet the degree. The bachelor's degree requires that you have 60 credits in general education, and so you'll only be transferring in 30 or so from your pre-licensure program, so you will need to take a sufficient number of gen ed credits in order to meet the degree requirements. These are our nursing electives. At least one elective is required. More can be taken depending on the room in your program and how many credits you transfer in. So for our clinical options, as I mentioned, for the first course where a clinical is required, Nursing 303, Community Nursing, students have 2 ways that they can complete that. The first is that you ask us to place you, and we usually do that with one of our clinical instructors at a senior center or community-based program, 1 day a week for 7 weeks. And we also have some other unique options. This year, for the first time, we actually had a group of students go to Haiti for 1 week, and that served as a wonderful international service learning experience that also fulfilled their community nursing requirement. We do have some other select options as well on a case-by-case basis. Students can also arrange for their own placement at a community site with their own preceptor. And those days and hours are flexible according to what works for the site, the student, and the preceptor. But do keep in mind that we often have to set up a contract, and that can take a little bit of time. We're happy to do that, but it does take a little bit of time. The other course in which clinical is a requirement is the Capstone in Leadership and Management. This is the last course in the sequence, and you want to plan for about 90 hours, or translated to about 1 day a week for the 15 weeks of the semester. The day and the hour are flexible. The focus is on quality improvement and patient safety, and it's really a semester-long project experience where you develop a project proposal to address a health issue on patient safety or quality improvement. You implement and evaluate it. We also encourage you to look at your place of work because many of your institutions do value students doing their capstone experiences at your place of employment. There are often many performance improvement or quality and safety initiatives ongoing at your place of employment, and they don't always have the manpower to be able to implement them. And so your capstone project could be contributing to your employer and helping them achieve one of their goals. Something that we want to also make you aware, this is relatively new for CUNY SPS, we do offer credit for prior learning. So for those of you who are certified as a certified emergency nurse or a CCRN or a certified wound and ostomy nurse, you can be awarded nursing elective credit for this certification. And that will be addressed when you get accepted to the school and you register, and we allocate a certain amount of credit for your certifications. More information about that is on our website. Here's our tuition and fees for the 2016-2017 tuition year. I don't know if there's plans to change that for the upcoming 27-2018. To my knowledge, it will be this. You can see that there's part-time as well as full-time options, and the graduate tuition rate is posted as well because we will be talking about our dual BS-MS options. Please note that because we're an online program, in-state rates apply to all students. So there's no out-of-state rate and in-state rate, it's the same. And students that are eligible can qualify for financial aid. So what do you do as far as the application process? You need to have a diploma, a nursing diploma or an associate degree in nursing, or be a new graduate who is going to be graduating this May or June. You need to have a New York State license, or for those of you who are brand new graduates, we do accept a select number of students that are new graduates before you've taken your NCLEX, and that's done on a case-by-case basis. We do look for a GPA of 3.0. SPS requires students to submit a personal essay, and you do have to submit your official transcripts. Even if you're a CUNY student, you need to submit an official transcript. The application deadline for the RN to BS program for the fall is June 1st. We encourage you to apply early and as soon as possible. And we do have rolling admissions, so once your application is complete with all of your transcripts, you will get a response from us very quickly. Official transcript evaluations are available through the advisement office before you apply, and you can actually go on the website and set up an appointment for that. You can sit down and find out, get a good sense of how many credits would actually transfer into the school. We accept a maximum of 90, and that's because the state education department rules say you have to have at least 30 credits completed on campus, meaning at the school, in order for the school to be able to award the degree. And the credits have to be from an accredited college or institution. So I want to talk a little bit about our new options, and these are our dual degrees. Students who are interested in obtaining a bachelor's and a master's degree at the same time can opt to apply to our BS/MS in nursing, and we have two tracks that will be open in the fall. One is in nursing organizational leadership, and the other is in nursing education. And it is a seamless progression. It's a fast track from the BS to the MS, whereas the BS is normally 120 credits and the MS is 45. When you do it as a dual degree, you get both degrees completing 150 credits. So that's a saving of about one semester or 15 credits because we are able to apply a select number of the graduate courses towards your bachelor's degree. An application deadline for this is May 15th for the fall. We will be accepting candidates in the spring as well. So if you look on the left side of your screen, that is the list of our curriculum courses for the bachelor's in nursing. And on the right side of your screen, you can see that some of those courses can be satisfied by the graduate level courses. These are our core courses for both MS programs, so you would complete these core courses first before moving into the specialty areas. And all of these are available on the website. If you click on the full curriculum, it will bring up the list of courses for you. These are the specialty courses in each of those areas, and each of them concludes with a practicum, a 6-credit practicum that you do in relation to that particular nursing track. So the nursing education track, for instance, you will do a practicum in nursing education, either at a school, with a nurse educator at a facility, and yes, we can help make those options available at your place of work if your employer is willing to support that. The nursing organizational leadership practicum will be a practicum in a leadership track as well. So just be prepared that that is something that would be completed as part of this degree. And this would be what you would do instead of the capstone at the undergraduate level. So take that into consideration. So the MS in nursing education will help you to examine accreditation practices, both at the national and state standard. It'll help you adapt strategies for diverse learners, develop curriculum, how to prepare students as well as graduates to function in their expected RN roles, and those who complete this degree are qualified to serve as educators in both community colleges as well as major universities, academic health centers, and community-based health facilities. It also makes you eligible to pursue doctoral education. The organizational leadership track will help you lead change and improve patient outcomes. You'll work on promoting evidence-based nursing research and practice, building collaborative interprofessional teams, and managing care coordination with an interprofessional staff. And graduates from this track are qualified to serve as directors of nursing, chief nursing officers, nurse managers, accountable care coordinators, wellness program directors, among many other leadership roles. For this program, you need to have your AAS in nursing, your associate's degree. You need to have a 3.0 or better and an unencumbered RN license and registration. There is also an admission essay, recommendation letters, a description of your evidence-based practice project, and your resume. So how do you apply? Well, if you are already a CUNY student, you can apply through the CUNY portal. If you are not, you have to set up an account in the CUNY portal, and you can find that on the web page. You would apply online, and you would apply as a transfer student. All students that come to CUNY School of Professional Studies are transfer students, so make sure that you circle that particular item so that you don't get tracked in a different direction. And we just want to conclude with some recommendations to think about as you begin or as you are evolving in your professional practice. Know that shift happens. Who remembers the days of file folders for your patient records? Now we have transitioned to electronic health records. Who remembers the days of clunky, oversized desktops, and now we have sleek tablets and laptop computers? Things will change. The healthcare delivery world is not going to be the same place 5 years from now that it is today, and the best way for you to be able to prepare yourself for opportunities is through education. So we encourage you to go to our website, look at our web page. If you have specific questions, feel free to follow up with us. You can get more information by contacting us at these numbers. You can find us on Facebook, where we find and post lots of information about the program that you can learn about us as well. And we're happy to take any particular questions that may come up at this particular time. So I see a few that I'm going to just address. Someone asked about, do I have to take statistics before you apply to the program? No, you do not have to take it before you apply. You can actually apply and take it when you're already here in the program. I know that some schools require that you complete statistics or chemistry or other prerequisites before you can put your application in, and we don't do that. We review your application. We accept you right into the nursing program. You can start nursing courses right away, and we encourage you to fill in your program requirements and your general education requirements as you move through the program. Another question I see is the transfer application for CUNY SPS separate from the application for the other CUNY schools? Yes, it is. So I'm going to go back to that screen that I showed you. You do have to apply as a transfer student to CUNY SPS. You will not find us on the page where you see the other schools listed. So you do specifically have to say I'm applying as a transfer student. Okay. Somebody said they already applied to the online RN to BS program and they're waiting confirmation of their transfer credits. Would they have to reapply to the RN to MS program? We anticipate that we will probably have students in the BS program that may be interested in moving to the BS-MS program, and so we will set up a process for a program change if in fact that's something that you want to do, if you've already been enrolled and accepted. Another question related to pathophysiology. We have in CUNY SPS a course called Pathophysiology and Pharmacology. That is the name of our course that we identify as meeting the requirement for pathophysiology. If you opt to take that at your pre-licensure program, that's certainly fine, but the course that you should take is pathophysiology. Someone else wanted phone numbers to reach, so I'm going to put that page available as well. Okay, someone had asked about how do they find out how many credits will transfer to the school. I encourage you to set up an appointment with on the web page. When you look at the application page, there is actually an area for you to set up a transfer evaluation appointment so that you can get that information. Somebody wanted to know about where do you find advisors. You're assigned an advisor after you are accepted into the program and you've indicated that you are interested in coming. So then your advisor is assigned to you to help you set up a program plan for what do you want to start with. So that will come after the application acceptance process. So I see a question from someone who has a previous bachelor's degree and wanting to know if they will have to take general education courses. Usually students who have a previous bachelor's degree have already met the general education requirement. There may be some specific nursing program courses that you'll have to meet, but in general, if you have a degree, a bachelor's degree already in another discipline, you more than likely will have met the general education requirements, and you will likely only have to take the nursing courses. Okay, I think we've answered most of the questions. I will stay on the line a little bit longer to address anything else that comes up. I see someone just asked, where are we located? We are actually located, we do have a campus in Manhattan. I'm going to scroll back to that slide. We are actually located at 119 West 31st Street. I'm pretty sure that the address is on one of these slides that we did not list it here, but we have a picture of the number, 119 West 31st Street in Manhattan, between 6th and 7th Avenue. So we do have a campus, we do have a building. The library is here in Baruch. Baruch College Library is the library that we work with. It is also located in Manhattan. But as I said, the wonderful thing about technology is that you do not have to physically go to the library anymore. You can do most of that work online, although as a CUNY SPS student, you are eligible to go to it. Someone wanted to know what courses they need to take to graduate. Well, the courses that we discussed are the courses that you need in order to get your nursing degree. So those would be the courses for nursing as well as the general education courses. And then if you were opting into the BS-MS program, you would need to take all of these plus the specialty courses. And if you opt into the BS-MS program, you will get both a bachelor's degree and a master's degree. Do note that the tuition will be at the undergraduate level until you accumulate your 120 credits, and then you will be charged the graduate tuition rate, which is a little bit higher. You are not considered Baruch students. You are considered CUNY School of Professional Studies students. and you do have access to Baruch's library as well as all the other CUNY libraries. Do you have access to CUNY general resources? I'm not quite sure what that means, but you are a CUNY student, and so you're eligible for all of the CUNY access to CUNY students. I'm not quite sure. Someone had a specific question about the master's program, so I recommend that you send me an email separately so that I can address that. So that if you have a specific instance or a specific situation, I'm happy to do that. Letters of recommendation for the RN to BS program, we are not a requirement. We do ask you to write an essay, a personal essay statement of 250 words, but we don't ask for recommendation letters. It is a requirement for the Okay, I want to thank everyone for their time and attendance today. Once again, this is Dr. Marge Riley. I'm the Academic Director for Nursing here at the CUNY School of Professional Studies. We're very happy that you joined us today for this webinar. Those of you that registered for the webinar will be given a link to access the recording so that you can refer back to it. Please note that we are on the webpage, sps.cuny.edu. On the nursing page, lots of good information. Please visit us there, visit us on Facebook, and we're happy to answer any follow-up questions that you may have. And we hope you have a wonderful day. Thank you again.